A 55-year-old man has a 3-day history of pain in his mouth and throat. He also experiences pain with swallowing. He has a history of COPD for which he takes theophylline. Physical exam shows white patches on the tongue and buccal mucosa that can be scared off easily. Appropriate pharmacotherapy is initiated. 1 week later, he returns because of nausea, palpitations, and tremor. Which of the following drugs was most likely prescribed? Now, initially, the patient presented with esophageal candidiasis, and we know that because he has white patches on the tongue and buccal mucosa that were able to be scraped off easily. So, this is an important finding, as well as the pain that he experienced with swallowing. These are going to be consistent with esophageal candidiasis. Now, in order to treat this condition, he was given a antifungal agent, and 1 week after this therapy was given, he later developed nausea, palpitations, and tremor. And so this is going to be consistent with theophylline poisoning. So the antifungal agent that he was given most likely reduced the metabolism of theophylline, and this increased the levels of theophylline in the body, resulting in toxicity. Now, theophylline is going to be metabolized by cytochrome P450. As a result, we need to look for a drug that is going to be an inhibitor of cytochrome P450. And out of these answer choices, only answer choice A is going to be a cytochrome P450 inhibitor. So the correct answer is going to be fluconazole. Now, answer choice B is amphotericin B. This is going to be incorrect. Amphotericin B can be used for invasive candidiasis infections, but it is not going to be a first-line agent to treat esophageal candidiasis because it has to be given intravenously, and its side effect profile is going to be much worse than other antifungal agents, so this is not going to be a preferred first-line treatment. Amphotericin B also does not have any known drug interactions with theophylline. Answer choice C is nystatin. Nystatin is going to be effective in treating oropharyngeal candidiasis, but it is not going to be effective in treating esophageal candidiasis, which this patient has. So because the patient is presenting with pain when he was swallowing, this is going to be consistent with esophageal candidiasis. Now, if he had oropharyngeal candidiasis, he would not be presenting with pain with swallowing. Answer choice D is griseofulvin. Griseofulvin is going to be a cytochrome P450 inducer. So it would actually decrease the levels of theophylline in the body because it would induce the cytochrome P450 to metabolize theophylline more. So this would not be consistent with theophylline poisoning.